My name is Lindsey Caudell, and I'm going to be going over using positive reinforcement to teach obedience commands to a pet dog, a multiple baseline across behaviors study. The purpose of this project was to evaluate the effectiveness of adding positive reinforcement and increasing the independent and correct responses of obedience commands with my dog, Remy. My dog Remy is a 2-year-old golden retriever who has no previous knowledge of any commands like sit, down, heel, spin, shake. So I wanted to see how ABA techniques could be applied to her to see if she can learn these obedience commands, which are socially significant to her. My participant in this study was a 2-year-old female golden retriever. This project occurred within my home in a calm, quiet setting, typically in the living room. This project was socially significant as it helps Remy with safety and me having control over her, as a lot of the times in social settings, she tries to jump on individuals and she tries to get in their lap when she doesn't know people. So this will help teach her to be calmer in social settings. It's going to improve her quality of life as well as mine and reduce challenging behavior, which is her jumping on individuals, which is something we do not want to happen. The research question for this project was, will the implementation of positive reinforcement with dog treats and or ice cubes and the independent performance of the command sit down and heel in a pet dog using a multiple baseline across designs? So, a couple of projects have been conducted similar to this where individuals were using dog treats as positive reinforcement as well as using shock collars. I wanted to see and use a least restrictive method rather than a shock collar to see if I was able to teach my dog these commands once positive reinforcement was added in. So, down below is the method section where I use a multiple baseline across behavioral design. I chose this method because I wanted to see the impact of multiple different behaviors all in one graph together. So, as you can see to the right, I have 3 different behaviors sit, down, and heel on the right stacked on top of one another. You can see the baseline phase as well as the intervention phase. The independent variable within my project was positive reinforcement. This is whenever we would add in a dog treat or a piece of ice. The dependent variable was the performance of the commands that were being worked on, specifically sit, down, and heel. The way that I collected data for this project was trial by trial recording. So I collected frequency data of whether Remy engaged in the behavior wanted or did not, and also the percent correct to see what percentage she engaged in across 10 different trials. So if she got an 8 out of 10, she scored 80% for that session. So, continuing on with the method section, the baseline phase was used to measure her existing knowledge of the skills being worked on. During this phase, I did not provide positive reinforcement as I did not want to impact the intervention phase. Once it was moved into intervention, it had to at least have a stable baseline, which was at least 2 days of baseline data. Once the intervention phase was added in, positive reinforcement was added and given to Remy when she engaged in correct responses, as well as prompting her of how to do the behavior correctly. Once it went into the intervention phase, it had to have at least 2 to 3 days of at least 80% accuracy for the next behavior to be moved out of baseline into intervention and so forth. Commands were introduced only one at a time, and correct responses were recorded daily, and reinforcement was only provided to her when she engaged in a correct response. So, as you can see below with my graph, there is a clear increase of the behavior once the intervention phase was introduced. As you can see, for all 3 behaviors, her baseline scores were really low. And once the intervention phase was introduced, there is a clear increase in the correct responses, and there's a spike in the behavioral data. There was an increased performance in both sit, down, and heel once intervention was introduced. So, all in all, in this project, Remy showed a low responding during the baseline phase. And once intervention and positive reinforcement was added in, there was an increase in her data, supporting the effectiveness across all 3 commands. This result supports that positive reinforcement is an effective and humane method for teaching obedience in dogs. So, some of the social limitations that I noticed within my project was it only included my one dog. I'd be very curious to see how this project would work if I did it with other dogs, depending on their drive and if they want to please their owner, as golden retrievers are often known to want to please their owners and obey them. This also occurred in a home setting, so I'd be curious to see how it would be impacted whenever she was in a social setting around other dogs or individuals. I also didn't collect IOA data, so I'd be curious to see what someone else thinks with this project, as well as this project could limit generalization as no one else was conducting the study with her. Down below, I have my references, and overall, my study concluded that using positive reinforcement as an effective method to teach commands to a dog.